A solution called Snap and Go. So this has an RFID reader, but it's also a vision system. So what's happening is, if I'm a nurse in say an operating room, I'm going to use these items in the surgery, or I'm preparing. So right now it just took a picture of it, it turned green, it pulled up on my software, and I can move on. I can use that in the surgery. And what's happening now behind the scenes is there's a cloud-based software and database that has over 1 million SKUs. So the software is actually parsing out the lot, batch, serial number of that item. It's, you can see part of the problems that the nurses deal with. Like, here's a label and I have multiple barcodes on it. And I got human readable information. I got, my lot number is in human readable. But this Snap and Go has the capability to do optical character recognition. It'll read barcodes, it'll read RFID, and then it parses out all the serial number, batch, lot, and then it associates it to a procedure number. So it's super easy for the nurses to use in a surgery. It will also capture expired items and also recalled items. So the actual Snap and Go will turn red to quickly identify so they don't use a recalled item. And then on the back end, this all integrates with the supply chain, the inventory management system. One of the things we're seeing is a lot of hospitals, because they don't have good control of their inventory management, they're overbuying supplies, and I think in some cases it's probably 30%. So they do get a lot of expired items because they're not maintaining that. So a lot of benefit, especially with the shortages we're seeing in the hospital.